Ginseng is one of the oldest medicinal herbs known worldwide. It has been widely used in traditional and modern healthcare. But can everyone safely use ginseng? Who should actually avoid it from the beginning? Are there any important interactions with common medications on the market? What side effects should you watch for? And what are the scientifically supported uses of ginseng today? If you are thinking about using ginseng, what key points should come to mind when choosing the right product? Stay with me to explore all of this clearly and simply. May peace, mercy, and blessings of Allah be upon you. I am Hussein Lotfi, and you are watching the Octopus Pharmacist channel. Welcome to a new episode of From A to Z Herbal. At the beginning, here are the main topics of today's episode. If you're looking for a specific point, you can move to the part of the video where this title appears. But if you want a complete and clear understanding of ginseng, stay with me from the beginning until the end. Let's start with a general overview and understand why this herb is important and widely discussed. First, ginseng is not a single plant. In fact, there are several species, but only a few are medically relevant. Many sources mention multiple types, but scientifically, the most important and studied ones are limited. All true ginseng types share one key feature. They are roots, often shaped in a way that resembles the human body. However, the main difference between these types is the concentration and composition of active compounds. And here, you need to be careful because some commercial products mix different types or even include plants that are not true ginseng at all. Later in this video, I will explain how to choose a high-quality product and how to identify effective concentration. Now, let us move to the second point. The two most important and well-studied types are Asian ginseng, also known as Panax ginseng, and American ginseng, known as Panax quinquefolius. These two are considered the primary medical types because they contain the highest levels of active compounds. There are other names you may hear, such as Siberian ginseng or Indian ginseng, known as ashwagandha, but scientifically, these are not true ginseng. They belong to different plant families, and their effects are not identical. So always remember, the real medical value comes mainly from Asian and American ginseng. Now, an important question. What are the active ingredients in ginseng? The main compounds are called ginsenoside, and they are responsible for most of its biological effects. So, what do these compounds actually do? In the past, ginseng was widely marketed as an adaptogen, meaning it helps the body adapt to stress in any direction. However, this term is not scientifically precise, and it is often misused in marketing because no substance can simply increase or decrease everything, depending on the situation. Instead, we focus on proven physiological effects. Let us simplify the main benefits into clear points. First, stress and cortisol regulation. Ginseng may help reduce stress by modulating the hypothalamic pituitary adrenal axis, also called the HPA axis. This system controls cortisol, the main stress hormone. When cortisol is chronically elevated, it can lead to anxiety, fatigue, poor sleep, and low mood. Ginseng may help bring cortisol levels closer to normal, not by forcing them up or down, but by improving balance. Second, anti-inflammatory effects. Inflammation is part of the immune response, but excessive inflammation can damage tissues. This can lead to symptoms like pain, swelling, and chronic disease. Ginseng may reduce inflammatory signaling by affecting pathways such as NF-kappa B. As a result, it can lower inflammatory markers like TNF-alpha, interleukin-1, and interleukin-6. This helps protect tissues and reduce chronic inflammation. Third, antioxidant activity. Every day, the body is exposed to harmful molecules from pollution, food, smoking, and normal metabolism. These produce what we call free radicals. Free radicals can damage cells, blood vessels, and even the retina. Ginseng acts as an antioxidant, helping neutralize these molecules. It may also support natural antioxidant enzymes, such as superoxide dismutase and glutathione peroxidase. This contributes to protecting organs and slowing cellular damage. Fourth, brain and cognitive support. Ginseng may improve brain function by influencing neurotransmitters like dopamine, serotonin, and acetylcholine. It may also increase levels of BDNF, which supports neuron growth and repair. This can help with memory, focus, and mental performance. Fifth, cardiovascular and immune support through its antioxidant and anti-inflammatory effects. Ginseng may support heart health. It may also have mild immune modulating effects, helping the body respond better to infections. There's also some evidence suggesting a role in reducing fatigue and supporting general vitality. Now, after understanding these mechanisms, we reach an important question. What are the evidence-based uses of ginseng? Despite many claims, we focus only on the most supported uses. First, reducing fatigue and improving energy. Ginseng is commonly used to reduce physical and mental fatigue, especially in people under stress or with low energy levels. Second, supporting cognitive function. It may help improve attention, memory, and mental clarity, particularly in situations of stress or fatigue. Third, supporting immune function. Some studies suggest it may help reduce the frequency of common infections, especially when used regularly. And also, it may help the body cope better with stress by supporting hormonal balance. So, in summary, ginseng is not a magical cure, but it is a scientifically studied herbal supplement with specific, measurable effects. The key is using the right type, at the right dose, and from a trusted source. In the next part, we will discuss safety, side effects, drug interactions, and how to choose the best product available. Stay with me. The second topic in today's episode is very important. Who should avoid using ginseng? And who needs to be especially careful? Ginseng is a powerful herbal product, and it can be very beneficial when used correctly. However, it is not suitable for everyone. There are specific groups of people who should avoid it or only use it under medical supervision. Let's go through them one by one, clearly and simply. First, people taking blood-thinning medications. This includes drugs such as aspirin, clopidogrel, and warfarin. Ginseng may interfere with blood clotting, and in some cases, it may reduce or increase the effect of these medications. This can increase the risk of bleeding or make the treatment less effective. So, if you are on any anticoagulant or antiplatelet drug, it is safer to avoid ginseng, unless your doctor advises otherwise. Second, patients with diabetes. You may have heard that ginseng helps lower blood sugar, and this is partially true. Some studies suggest that ginseng can improve insulin sensitivity and support blood sugar control, especially in prediabetes. However, if a patient is already taking anti-diabetic medications, ginseng may enhance their effect. This can lead to hypoglycemia, which means dangerously low blood sugar levels. Symptoms may include dizziness, sweating, confusion, and weakness. So, diabetic patients should only use ginseng with careful monitoring and medical supervision. Third, people taking antidepressant medications. Ginseng may affect brain neurotransmitters, such as serotonin, dopamine, and others. On its own, it may help improve mood and mental performance. But when combined with antidepressants, especially SSRIs or MAO inhibitors, There is a potential risk of excessive stimulation. In rare cases, this may contribute to side effects like anxiety, agitation, or even serotonin-related symptoms. So, combining ginseng with psychiatric medications should always be done under medical guidance. Fourth, patients with autoimmune diseases. These patients often take immunosuppressive drugs to reduce immune system activity. Ginseng may stimulate immune function, which can counteract these medications. As a result, it may worsen disease activity or reduce the effectiveness of treatment. So, in autoimmune conditions, ginseng should be avoided unless approved by a specialist. Fifth, people with blood pressure or heart rhythm issues. Ginseng does not have a completely predictable effect on blood pressure. In some individuals, it may slightly lower blood pressure, while in others, it may increase it or cause palpitations. There are also reports of irregular heartbeats, or what we call arrhythmias. So, if you have hypertension, hypotension, or any cardiac condition, you should be cautious and consult your doctor first. 6. People who consume high amounts of stimulants, such as caffeine, found in coffee, tea, and energy drinks, or prescription stimulants like amphetamines. Ginseng itself may have mild stimulating effects when combined with other stimulants. It can lead to excessive nervous system activation. This may cause insomnia, restlessness, headache, poor concentration, or even tremors. So, if your daily intake of stimulants is high, it is better to avoid combining them with ginseng. Finally, an important point for women, ginseng contains compounds that may have mild estrogen-like activity, but this effect is not strong or consistent in all studies. Still, caution is advised in certain cases, such as hormone-sensitive conditions, or during pregnancy and breastfeeding. Also, long-term continuous use is not always recommended. A common practical approach is to use ginseng for limited periods. For example, a few weeks to 3 months, followed by a break. This helps reduce the risk of side effects and maintains its effectiveness. So, after all this, ginseng is not dangerous, but it is not completely harmless either. The key is proper use, correct patient selection, and awareness of interactions. In the next part, we will talk about side effects in detail and how to choose a safe and effective product. Stay with me. The third point in today's episode is very important. Can ginseng be used during pregnancy, breastfeeding, in children, and in older adults? First, pregnancy. Ginseng is generally not recommended during pregnancy. Why? Because some of its active compounds may affect hormones and may have mild estrogen-like activity. There are also concerns about its effect on blood sugar and limited safety data in pregnant women. So, to stay on the safe side, it is better to avoid ginseng during pregnancy. What about breastfeeding? Here, caution is also needed. There is not enough strong evidence to confirm safety, and some components may pass into breast milk. This could potentially affect the infant, causing irritability, sleep disturbance, or digestive discomfort. So, it is best to avoid ginseng while breastfeeding, unless advised by a healthcare professional. Now, what about older adults? Ginseng is not forbidden, but it should be used carefully, especially if the person has chronic diseases or is taking medications like blood thinners or diabetes drugs. In some cases, it may help with energy, memory, and focus, but always, safety comes first. Finally, children. Ginseng is not routinely recommended for children due to limited safety data. Although some believe it may support attention or activity, there is no strong evidence for regular use. So, it should not be given to children. unless prescribed by a qualified doctor. So, always remember, natural does not always mean safe, and proper use makes all the difference. The fourth and penultimate topic for today is very practical. What are the side effects of ginseng? And if you decide to use it, how do you choose the right product and the correct dose? First, let us start with how to use ginseng properly. The best time to take ginseng is in the morning, preferably after breakfast. Why? Because ginseng may increase alertness, focus, and energy levels if you take it at night. It may lead to difficulty sleeping or insomnia. So, always remember the simple rule. Take it in the morning. Now, what about the general uses? Ginseng is commonly used to support memory, attention, concentration, and immune function. It may also help improve physical endurance, especially in people under stress or athletes. In addition, it may support better blood sugar control in some individuals. Now, let us talk about dosing. For most adults, the usual dose ranges between 200 to 400 milligrams per day of a standardized extract. If used as a liquid or herbal preparation, the dose may vary, depending on its concentration. So, always read the product label carefully and choose products with standardized ginsenoside content. There is also a specific use in cases of erectile dysfunction. In this case, studies have used doses around 900 milligrams, taken 2 to 3 times daily, under medical supervision. There are also topical forms, such as creams, which are applied before intercourse and should be washed off properly before contact. Now, an important note about children. Ginseng is not recommended for infants and should be avoided under 1 year of age. In general, its use in children is limited and should only be under medical supervision. Clear pediatric dosing is not well established, and over-the-counter use is not advised for young children. Now, what about side effects? Most side effects are mild and may decrease over time. These include headache, mild stomach upset, palpitations, or nervousness. However, one of the most common effects is sleep disturbance, especially if taken late in the day. Some people may also experience diarrhea or digestive discomfort. So again, timing is very important. Take it in the morning. Monitor how your body responds and always stay within the recommended dose. And remember, even though ginseng is a natural product, it still has real pharmacological effects and should be used carefully and responsibly. The fifth and final point for today. After all this useful information, how do you choose a high-quality ginseng product from the market? There are 3 main things you must always check carefully. First, the type of ginseng. Make sure the product contains one of the 2 clinically studied types, either Asian ginseng, known as Panax ginseng, or American ginseng, known as Panax quinquefolius. These are the only types with strong scientific evidence for effectiveness and safety. Second, the concentration of the product. Look at the dose per capsule or per serving if it is a liquid. Higher concentration does not always mean better, but it does mean fewer capsules and often better standardization. So, choose a product with a clear and appropriate dose based on your needs and recommended guidelines. Third, and most important, the active compound content. The key active ingredients in ginseng are called ginsenosides. A good quality product should clearly state the percentage of ginsenosides, usually standardized between 3% to 7%, or sometimes higher. If you find a product with a very low percentage, for example 1% or less, this usually means weak potency and less clinical effect. In that case, You may need higher doses, which is not always practical or safe. So, always choose a standardized extract with clearly labeled ginsenicide content. Now, one last important point before we finish. Ginseng should not be used continuously for long periods. It is better to use it in cycles. For example, 1 to 3 months of use, followed by a break. Why? Because continuous use may reduce its effectiveness over time, and the body needs time to reset and maintain balance. Now, we have reached the end of today's episode. I hope this video has provided you with clear, useful, and practical information. If you found this content helpful, do not forget to support the channel on Patreon, PayPal, and YouTube. Have a great day. Hussein Lotfi, Octopus Pharmacist.